Welcome to MedicoApps PDS Express. In today's class, we'll be discussing one of the very interesting questions. So this question is basically from oral medicine, or you can say oral peth. Now, before starting, let me tell you that if you have not subscribed to our YouTube channel, please do subscribe and press the bell icon so that whenever we update any new video, you'll automatically get updated. Apart from this, we are also posting updates on WhatsApp group. So you can just press this link www.medicoapps.org/groups. You can just use this link and directly you can join to our WhatsApp group, and there we are posting updates related to your year. Suppose you are a first year student, so we are posting update related to human anatomy, dental anatomy, physiology, biochemistry. Similarly for second year, third year, final year, and for intern, post intern as well. And you can use these groups, and if you feel that they are not worth, you can just quit these groups whenever you feel like. So let's start with the question. So this question has been asked in AIPG exam, and the question was: radiographically, snow driven appearance is seen in, and the options given were AOT, that is adenomatoid odontogenic tumor, COC, calcifying odontogenic cyst, CEOT, calcifying epithelial odontogenic tumor, and keratocyst. And this was the OPG given. Now you can see here that this is the pathology, and this is typical snow driven appearance. And you can see this impacted tooth here, radio opacity here, you can see kind of impacted tooth, you can say, or the third molar. And here also you can see that there is tooth lying like this. Now let's start with the answer. So basically this is CEOT, that is calcifying epithelial odontogenic tumor, also known as Pindborg tumor. Now let's see the radiographic characteristics of this tumor. Now first of all, it represents less than 1% of all the odontogenic tumor. So first and foremost thing is that it is odontogenic tumor, that is arising from the tooth itself, or the mesenchyme of the tooth. Second is the common age for this tumor, that is Pindborg tumor, is 20 to 60 years of age, and the mean age it is 40 years. Now coming on to maxilla-to-mandible ratio, so it is more frequently seen in mandible, and ratio is 1:2, maxilla to mandible, right? Now it is mainly located in the premolar and molar region. Now clearly you can see that this is molar region, and it is extending up to the premolars. Then half of the cases, they are associated with an impacted tooth. Now all these features you can just clearly see in this OPG. It is associated with the impacted tooth. Mandible is more common as compared to maxilla. Then premolar to molar region, age is 20 to 60 years, but the mean age is 40 years, and it is odontogenic tumor, that is rising from the tooth. Impacted tooth is there, right? Then second, now how it affects the surrounding structure. So in related teeth or tooth, you can see tipping, rotation, like here you can see in the previous image rotation was there, you can just check that. Then migration of the tooth, that is pathological migration or mobility, and root resorption as well. Here also you can see root resorption, right? Now this lesion, it is often said to be symptomless, and it is like on routine radiograph, this is the incidental finding if there is not evident swelling on the right side or the left side of the face, that is the mandible. But in some cases it is symptomatic, and patient will come to you for this only. That means the patient will come to you and they'll say that, doctor, I'm having swelling on my right region since from last 3 to 4 months, and it is slow growing or painless. It started with a small mass and now it is enlarging. So it could be symptomatic, and it occurs as slow growing, painless, expansile bony lesion with cortical bone resorption. If you palpate on palpation, you'll see that there is bone resorption, that is cortical bone resorption, and finally there will be perforation, that is through and through. Now apart from this, the other findings, radiographic finding, first of all, it starts with the initial stage of radiolucency. Now at this stage you can even confuse it with dentigerous cyst, since it includes the impacted tooth as well. Then this is the initial stage. So you can often confuse it with dentigerous cyst. Then comes the second phase. Now in second phase, what you can see, intramural calcification, which start appearing in the second phase. But all these things, they are characteristic, but they're not diagnostic. Now the final stage or in the later stages, what you can see, there will be osseous destruction and the tumoral calcification. Now all these things will give rise to snow-driven appearance. So this is the reason, and this is one of the very commonly asked questions in your viva, whether it is oral medicine and radiology viva or oral pathology viva. So you need to know the reason why exactly snow-driven appearance is seen. So if the examiner is asking, you need to tell that the radiographically you can see three phases. In first phase there will be complete radiolucency. In second stage you can see minor calcifications, but they're not characteristic. Now in the stage 3 of phase 3 there will be complete destruction, that is osseous destruction and tumoral calcification, and that will eventually give rise to snow-driven appearance. Now coming on to the differential diagnosis. Now if you are giving exam in oral medicine, differential diagnosis is one of the most important question which examiner will ask you, and even for your written exams they'll give short notes or they'll ask long questions. So you need to write the differential diagnosis. Even if you're practicing from practical point of view, you need to know the differential diagnosis, that other than this what all it could be. So CEOT, the differential diagnosis is AOT, calcifying odontogenic cyst, ameloplastic fibro odontoma, and odontome. All these, they are the differential diagnosis of CEOT or Pindborg tumor. Now coming back to our question, so the answer is CEOT, or they can ask it as Pindborg tumor. So this was all about the class. Hope you like it. Again, I'm reminding, if you have not subscribed to our YouTube channel, please do subscribe and press the bell icon, so that whenever we post any new video or any new question discussion, you'll automatically get updated. Thank you.